Welcome to Senior Moments. I'm Vickie Carraher, the Senior Service Coordinator for the City of Kettering. What is so frustrating to so many people is navigating the healthcare system. There are doctors and specialists and all kinds of different things, and sometimes it's so overwhelming, individuals just really don't know what to do. Or I may have been very, very healthy in my life and not really needed to go to a doctor very often, and now I'm facing an illness and need to find a doctor. So there are lots and lots of options available through Kettering Hospital's new Navigator program. And from Kettering Health today, I have Pam Walker, and welcome to Senior Moments.
Thank you. Good morning.
So what is the Healthcare Navigator program?
Well, this is a brand new program that just started in January of 2022 at Kettering Health. And the whole purpose of our program is to help people in the greater Dayton area navigate the complicated healthcare system so they don't become frustrated, and so that we can help them improve their health and their well-being.
So are you affiliated with a specific hospital or just the whole network?
We're with the whole network, where our location is actually in Beaver Creek, and we're housed under the Department of Community Outreach. But we serve the greater Dayton area in all locations.
Okay, that's awesome. So how long has this program been in existence?
It's really a brand new program. We say we're only 5 months old. We started in January. There are 3 employees. 2 of us are part-time, 1 is full-time, and we had to start from the ground and come up with a mission statement and determine who were we going to serve and what services we were going to offer. We had to create our marketing materials, our handouts, our business cards, and then start going out and speaking to organizations and let them know that we existed.
It must be very nice, though, I know, to have that ownership of the program instead of somebody handing it to you and saying, just do this. Was it exciting, or was it one of those things where you're like, ooh, this is a little, scary?
That's a great question. A little bit of both. Denise and I started the program in January, and then Tara joined us, and it was we didn't get a lot of guidance, but we got a lot of freedom, but we got a lot of support and trust. And they said, we trust you. Go out and start the program. Stay in touch with us, because we have a supervisor that we answer to and check in with on a weekly basis. And so it was intimidating, but it's also exhilarating when you know you have the freedom to go out and touch lives and to inject what we think is important and valuable for the program.
Navigator could mean a whole lot of different things. What in this program, what is truly a navigator position that you are with this program?
Well, within the Kettering Health program, we are called Healthcare Navigators. And our goal and objective is to help individuals, families, seniors, whomever, navigate what we would call the complicated healthcare system. And that can address a variety of issues, from finding a doctor to finding assisted living facilities. And this is actually a position that is evolving in our country today. And I've done some research on that and learned that there is a professional organization of independent healthcare advocates who charge for their services. They usually have had a background in healthcare, and they are reaching out and offering independent services to individuals. They charge for their services, but that is an independent program that is that is not what we offer here at Kettering. At Kettering, we offer a free service.
So everything's free?
Everything is free. And we can't offer the one-on-one service that you can do as an independent healthcare advocate, but we can offer a lot for free.
So are you able to it's not just one phone call and done. It may be you having to answer a couple of different questions throughout more phone calls, or how does that work?
Oh, that's another good question. Occasionally we can answer it with one phone call. For example, we got a phone call a couple weeks ago from somebody who wanted to donate their body to Wright State and didn't know how to do that. And so we made a phone call, got the information, emailed it to them, and we were done. But sometimes it can require several hours, and there are 3 of us on the team, so we divide and conquer, and we decide who's going to address what part of that question or that challenge, put our heads together, And it can take a couple of hours with lots of phone calls and lots of emails. It just depends on how complicated the request and the need is.
So many people tell me that, well, why don't these people just go get a new doctor? What are some of the barriers to finding that health care?
There are lots of barriers. I wish it were as simple as it used to be when you could go to the yellow pages and look under physicians and find a specialty and make a phone call and you got an appointment for the next day. But healthcare is changing in America. We used to have the family physicians who would visit us in our homes and come and take care of us and provide what we needed. And some of the people who are watching this program may remember those days. I didn't have a physician who visited me at home, but I know a lot of people have. And then as we've evolved through the years and decades, we started having family practice doctors and then primary care doctors who, again, you could call them, get an appointment quickly. But that's changing now, and only a third of the doctors in America are primary care physicians. The rest of them are specialists. And so it's much harder to find primary care doctors. In fact, it's challenging for us sometimes to find a doctor.
I've had the same doctor for 35 years, and he's getting ready to retire, and I'm like, no, you can't retire. I'm not done with you yet. So I understand how that can be. And
that's happening to a lot of the clients that we're serving because they have been with a physician that they've learned to trust, and it truly has been their family doctor who perhaps delivered their children and have and now are they're the physician for the grandchildren, and they're going to retire, and that can really be anxiety producing and stressful for these individuals. So we try to help them find doctors because there are a lot of physicians out there whose practices are closed and they're no longer accepting patients because their capacity has reached the maximum level.
It is so hard for individuals to find that, and so much is on the internet right now. And I have people come to me and say, well, I called somebody and they said, well, you can find us on the internet, or we can give you, you need to request an office visit. And they're like, I don't have a computer. I don't even have a cell phone. How am I supposed to get with that? So are you able to help those individuals?
Absolutely, and that's one of the services that we offer. If they call us, tell us what they want, we are never going to direct them to the computer unless we detect that they are tech savvy and they're comfortable and they have a smartphone or a computer. Otherwise, we're going to ask them what they need. We're going to do the independent research for them, and then we'll call them back and lead them, for example, to a physician who is accepting patients and uses their insurance, lives in or works in the area that person lives in, and we'll hand off and give them the phone number and say, now you can make the phone call they're expecting to hear from you.
Okay. If someone doesn't have insurance, are you able to guide them to specific programs that might help there?
Yes, we're actually helping an individual right now who's 22 years old, and most of this has been via telephone. But he was 22 years old, type 1 diabetic, basically an orphan. His mother died when he was 16 of diabetes herself. So he has slept on couches of friends for the last 6 or 7 years and has had no doctor, no insurance, and didn't really know how or where to go to get the help. So our first decision was to help him find insurance, but until then, we sent him to the Good Neighbor House, where they provide health care for uninsured people. And then our next project was to help him get connected with Job and Family Services and start the Medicaid process so that we could connect him to CareSource so we can help him with Medicaid services.
There are just so many barriers, and a lot of us take for granted the ability to, if my knee hurts, I call an orthopedic doctor, or if I'm having problems with nervous issues, I can contact a neurologist. I can do any of those things, but so many people aren't able to do that. I can't imagine what that individual's life would be like down the road, having diabetes and not getting that care.
Right.
That must make you feel really good about what you do.
We love what we do. We can't believe we get paid to do what we do. We all have nursing backgrounds, and so we understand, but we're used to working in stressful situations with too much to do at the end of the day, and sometimes not even being able to help the individuals. So for us to be able to not only create a program, but then to reach out and to help individuals, it's just a win-win situation.
Awesome. So who do you serve? What kind of individuals? It sounds like you're serving, this is Senior Moment, but you're serving other individuals who aren't seniors. And so if you're a senior and you usually tune into the Senior Moment show, and you may have a grandchild or a great-grandchild or a son or daughter who might need this service, so you're just open to anyone calling in.
Actually, we have a slide that we can show you that says, who are we serving?
Okay.
And as you'll see on the slide, we've minimized it so we don't confuse everybody, but we help individuals, we help families, we help seniors. Actually, there's nobody we don't help. We reach out to everybody, but we've helped individuals of all ages. In fact, we got a phone call from a mom who has a 42-year-old son who has mental illness with some physical complications also. And evidently, he has not had good success or experience with other physicians in the past who become frustrated because of his mental illness and dismiss him prematurely. So the mother told us the situation, and we supported her and her son, reached out and found a nurse practitioner who was willing and able to spend an hour with this gentleman, listening to him, affirming him, validating him, gaining trust, and then starting to order the appropriate medical test for him. So in that capacity, we served an older mom who's probably in her 70s and her 42-year-old son. But we help children. It doesn't matter where people live. They don't have to be in Kettering. We have helped people in Pennsylvania. We got a phone call the other day, and I'll tell you about that a little bit later, who needed some help, who wanted to come to Kettering for surgery and didn't know how to come and how to get the insurance to do that. So we navigated that question and situation for him.
So you're learning as you go as well.
We are learning.
I say that about my job every day. It's like there's so much of my job is people will come to me and say, you know, I need to do this, and I'm like, not sure how I'm going to help you do that, but I do then, you know, try to, and then the next person that comes along, I've got, you know, that tried experience to help individuals.
Well, we say that we are generalists who do lots of research and who will help triage and help connect somebody to the next resources. Like the more we've learned about your particular connection and all that you offer seniors, we are thrilled because now we can start to refer people to everything that you offer, and we didn't know you existed until a couple of weeks ago.
I think that was what was so exciting was individuals. We just met this week actually, and I said, you know, I got to have you on the show because what you're doing is so important, and so it's very exciting. Tell us a little bit about, you know, someone that you might have served.
Okay, well, why don't we start with what we do offer?
Okay.
And then I can give you some examples under different categories. How's that work?
That works.
So let's pull up another slide, and we're going to show you what we want you to think of us as. And we want you to think of us as coordinators, educators, and advocates who provide help, support, advice, and service and guidance. Okay, and so flipping over to the next slide, we have 3 columns here, and it says, what can a healthcare navigator do? Well, let's start with helping connect people to a physician. We had one call about a month ago with a gentleman who very specifically wanted a primary care doctor who had experience with Agent Orange. Wow.
Yeah.
How do you start with that? Well, I think God provided the help for us, as He always does, and so we were able to make some phone calls, and lo and behold, we found a primary care office that said, well, we have several physicians, but one of them in particular has helped a lot of people with Agent Orange. So we were able to connect.
That's a very specific experience. Wow.
Yeah, and so we have that physician's name for the next person with Agent Orange issues. But that would be an example of helping somebody find a physician. We help schedule follow-up appointments. We had an older lady who called us, and she was being discharged from the hospital. She needed to follow up and see her doctor, or specialist actually, within a month. And she'd been calling and was frustrated because nobody was returning her phone calls or the line was busy. So she explained the situation to us. We did some research and found that that particular office had 3 different locations.
Oh.
So we called another location on her behalf and had that location called the primary location to say, please call this patient, they're trying to get an appointment with you.
Okay.
So we were able to help her get a follow-up appointment with the specialist, and she was frustrated and confused and didn't know how to get that appointment. So
I have experienced that. My doctor may say, you need to go to this specialist, and you call that office, and it's like, well, it's 5 weeks or 5 months we can get you in, and it's like, well, I'll be dead by then. It's kind of frustrating when you actually need the service.
well, I think that's one of the benefits that we're discovering we have when we call an organization or a physician's office and we identify ourselves as healthcare navigators within the Kettering system. And if we explain a particular situation where somebody needs to get in quickly, it's heartwarming to know that they trust us, they listen to us, and sometimes we can make that happen.
Yeah.
And we can explain a situation whereas a patient may be intimidated and not realize they can be gently and appropriately assertive and explain the situation. They just are taught to be respectful of medical authorities and to say thank you very much and to take the appointment in 6 months and then to hang up.
Yeah,
Yeah.
that is hard.
Yes.
I continued on and ended up getting a cardiologist within the next 3 weeks. But
Yeah,
it
but
was
not everybody
frustrating.
perseveres like
Yeah,
you do.
and I know that is the situation. My unique training, helped me do that, but not everybody has that training as well.
No. So let me tell you a few other services we offer. We educate. Again, I'm sure you've discovered this. A lot of people don't realize what they don't know because they don't know it. And so we educate individuals about the healthcare process. We got a phone call from a woman who needed ankle surgery, but she assumed that she wouldn't qualify for help in the home afterwards. And she knew her husband was disabled and he would not be able to help her. So she assumed she couldn't have surgery. Well, we educated her that she should call the orthopedic surgeon, get the appointment, and go talk to him and his staff, and they would be able to line up home care for her in her home. Again, it was an education process. She had no idea.
Yeah.
No idea. And we love to educate audiences. We are speaking to some of the Rotary clubs and the Noon Optimist. And we've been to some of the senior centers because we love to educate, empower, and equip people in our audiences so they can take charge of their health. And we let them know we're available if they need help. But if we can educate and empower them to do it on their own, then that's exciting and freeing for them.
So you would be open to groups or organizations who might want a speaker or want someone to assist them. You would be open to that as well.
More than open. We are asking for those opportunities because that's one of the best ways that we can market ourselves and let people know that we exist. Again, we're not selling a service. We have a free program to give, but people don't know that we exist. And then I guess another category is advocate. We try to teach people how to advocate for themselves and what resources are available. For example, I referred to a case that we got from a gentleman in Pennsylvania just this week, 19 years old, an athlete who had injured his finger with baseball and heard that we had a renowned hand surgeon in Dayton and he wanted to come here for that hand surgery, but he didn't have insurance. So we made some more phone calls and we were fortunate enough to find somebody who used to work in the Pennsylvania system and was able to educate us about not only the Medicaid system but the commercial health resources. So we called this gentleman back, gave him the phone numbers and said, you'll need to do this and these are the questions that you should ask when you call for the different information. Once you have accomplished that, call us back and we'll walk you through the next step. So we're empowering, equipping, and teaching them to be their own self-advocates.
And I think one of the things that I like best is you are doing that, but you're not saying it's a one and done phone call. if I encounter issues or problems, I can always call you back and you can educate me how to get through that as well.
Exactly. Oh, absolutely. Some people only need one phone call, but again, especially when we're helping with a complicated case or seniors who are a little unsure of themselves, we're happy to hold their hand and walk through them until the case has been resolved. Yeah.
Now, are you stuck just with the Kettering Health Network? Can you refer outside of that network?
That's a tricky question.
I know, I'm like that.
Well, obviously, because we are employed within the Kettering Health System, our first recourse is to see if we can find somebody within Kettering Health that can offer it, the service. But occasionally, if we find that it's a program or a service that we don't offer, we're going to give them some choices. And we won't give them one organization within the greater Dayton area or even within Ohio that offers it. We'll give them several and say, these three options can be available.
I said that just because I heard you say that you had referred somebody to Good Neighbor House.
Well, they're actually under the Kettering Health Network system. Did you know that?
No, I did not know that.
Yep.
So
they are part of the mission.
That is interesting to hear.
Yes, exactly. Yep.
That is awesome.
And then we also can advocate and represent individuals on their behalf because, again, sometimes people are intimidated and don't know how to even ask the questions. So, for example, this 22-year-old who has diabetes and who was with the system, we made phone calls on his behalf to find out what his options were. And then when we had all the information and specific names and phone numbers, we called him with that information so he could make the phone call for himself. But we opened the door first so he didn't have to start from ground zero.
Yeah. I think it's good because there are different types of people like myself. I'm somebody who's gonna keep pressing, but there are other people that are like, oh well, this door's closed, so I'm gonna give up. And there are so many other things out there.
Well, for those people who are discouraged and who have run out of resources, we encourage them to call us.
Okay.
Because we want to help the people who are overwhelmed, who are frustrated, who are discouraged, who need the care but don't know how to get it or where to get it, or they're so exhausted because they're a caregiver and they're trying to help somebody in their home and they don't have the time to make the phone calls and do the research. Call us because that's what we love to do, that's what we want to do, and that's part of our mission statement is to reach out and help everybody.
So it doesn't necessarily have to be the patient. It could be a family member who is a caregiver who you're going to assist rather than the patient.
Right, we talked to a gentleman whose wife has had many strokes over the last 7 years. She was the primary patient for a while, and we helped him find some resources for her. But now he's having surgeries, and so he needed help finding caregivers for his wife while he recovers from surgery. So we've helped find resources for him, and then we helped him find caregivers that could come into the home to care for his wife while he recovers. So we've been helping the entire family, helping him and help her at the same time.
That's awesome, because I know so many right now are caring for loved ones in the home with dementia, and that is just so stressful that sometimes you fall into bed at night and go, I could do something to fix this, but I don't even have the energy to do that.
They're exhausted, they're depleted, and again, we're here for those people so that the caregiver can, if they can have 5 minutes to give us a call, tell us what they need, then we'll do the research for them and call them back during the day or even in the evening on the weekends. Whenever it's most convenient, when they are available to talk, we'll make that phone call to help them.
So this is amazing to me, but I have to ask you, just to make it clear, how much does this cost?
Nothing.
Nothing.
It is absolutely free,
that is my favorite answer. It costs nothing.
Which makes it so much fun for us to promote, because usually there's a gimmick.
Yeah.
Well, this sounds too good to be true, and it usually is too good to be true. But in our situation, it really is true. There's no fee. This is a service that Kettering Health is offering the greater Dayton community. Again, if we can help find a resource within Kettering Health, we're going to be happy to do that. But if that resource doesn't exist, we'll help them find it wherever it is.
That is amazing to me. Anything else that you wanted to let us know about?
I don't think so. I think we've covered it. We're here for everybody, all ages, wherever they live in the greater Dayton geographical area, or if they have somebody who's out of state and has a question for a resource within the state of Ohio or within the greater Dayton area, call us, let us do the research and see if we can help.
So give everybody, can they go to a place, or do they need to call you on the phone? How's the best way to get a referral?
Good question. At the moment, we're not really meeting with people one-on-one. It's more of a call center. I don't like use that word because a call center sounds so regimented, and we're not regimented. But we will answer your phone call, or we will listen to your email, and then we will respond appropriately.
Okay. So give me a phone number. What is the best way?
Well, we're going to put that on the screen, but it's 937-558-3925.
That is awesome.
And you can just leave a voicemail message, and we'll be happy to return the call.
That is just so exciting. I am so glad to have you, Pam. Thank you for being with us, and I get just as educated as the people in the audience. So
it's been a blessing. Thank you, Vicki.
Thank you. And for all those who live in the city of Kettering who have other needs or services to deal with, please call me at 296-3356. That, of course, is 937-296-3356. Thank you for coming, and we will see you next month on Senior Moments.